Greetings, my name is Becki Hale. I'm a doctoral candidate in the EDD Learning and Organizational Change program at Baylor University's School of Education. This video shares a synopsis of my research prior to my dissertation defense. The title of my research is Dental Caries, Obesity, and Asthma During Childhood, a qualitative multiple case study to determine where community-based prevention strategies intersect to guide a coordinated approach for 21st century families. I'd like to say thank you to my dissertation defense committee and a special thank you to my faculty advisor, Dr. Tony Talbert, for his supreme guidance and expertise, as well as his genuine care and support. Thank you for tuning in today, and I hope you enjoy my presentation. Dental caries, which is a scientific term for tooth decay, obesity, and asthma are common chronic conditions during childhood. Each of these health conditions is widely prevalent among children in the United States, especially among children from families of a racial minority or low income. Not only are these three chronic conditions common among children, but they can be comorbidities of one another and share many of the same risk factors, particularly those risk factors influenced by the social determinants of health. Community-based prevention strategies do exist for the prevention of dental caries, obesity, and asthma during childhood, but the strategy efforts are more siloed. Research is lacking, and there's a missed opportunity not to address the prevention of childhood dental caries, obesity, and asthma more collaboratively, especially given their relationship. Successful community-based prevention strategies often require a systems-based approach, interdisciplinary collaboration, and a well-educated community to align prevention messages and practices. The aim of this multiple case study was to identify barriers and successful commonalities among community-based strategies aligning with a spectrum of prevention framework that work to prevent dental caries, obesity, and asthma episodes during childhood. Learnings from this case study provide recommendations for a coordinated approach to community health professionals for addressing these three health conditions more collaboratively. With dental caries, obesity, and asthma sharing risk factors and often co-occurring among today's children, it was vital to use the lens of the spectrum of prevention as the posteriori theoretical framework in this multiple case study. The spectrum of prevention provides a methodology to synergize community strategies and uses 6 levels of prevention to move beyond the perception of prevention being solely educational strategies. To gain a well-rounded view of the circumstances within this research topic, this multiple case study involved parents, program staff, medical and dental healthcare providers, and community stakeholders. The case study utilized purposeful sampling techniques to ensure the participants in each case were able to describe a rich, unique perspective as it relates to the central phenomenon of a collaborative approach to community-based prevention strategies for dental caries, obesity, and asthma episodes during childhood. 3 parents and 10 program staff members interviewed were from the programs led by the Center for Children's Health within Cook Children's Healthcare System in Fort Worth, Texas, that address either dental caries, obesity, or asthma. 3 dentists and 2 pediatric primary care physicians for this case study were also interviewed, and all of the medical and dental providers work for or with Cook Children's in some capacity. And then finally, 6 community stakeholders who were either coalition members or trusted community partners with the collaborations led by the Center for Children's Health concluded the interviews. The perspective of program staff, medical and dental providers, and community stakeholders provided an awareness of what successes and challenges these groups of individuals face in working to engage families in community-based prevention efforts around dental caries, obesity, and asthma with children. The perspective of parents provided specific insight into the barriers that they face with seeking community-based prevention services to prevent dental caries, obesity, and asthma episodes with their children. Due to the stratified sampling that defines the multiple cases within this research study, I used an overarching question that pertains to all 4 cases, with each individual case having its own specific primary question. The decision to investigate a primary question for each case is because each purposefully selected case within this study provides a unique perspective. In order to synchronize multivariate prevention efforts for dental caries, obesity, and asthma from a community-based strategies lens, the discovery from each case must be treated as equally important, unique evidence. Data collection procedures involved semi-structured interviews, participant observations, and document review. Data analysis involved a within-case framework analysis and a cross-case thematic analysis, aligning with the spectrum of prevention. At the conclusion of the cross-case thematic analysis, it was determined that strategy alignment occurs between dental caries, obesity, and asthma, community-based prevention strategies around communication methods, meeting basic needs for families, trust and relationship building with both families and community partners, and provider organizational education. So within chapter 4 of my dissertation, when I present the findings, I present those from a reverse approach. So I begin with answering that overarching research question and presenting the overall qualitative data findings. Secondly, I move into the cross-case thematic results, followed by the within-case framework results and answering the individual primary research questions for each case. I'm going to provide a very brief overview of the overall findings within this study. This study found that between parents, program staff, medical and dental providers, and community stakeholders from the lens of dental caries, obesity, and asthma, that texting is the preferred method when communicating with families. It's also important when sharing community messages among the community to start early or begin as upstream as possible with those messages. It's also important to frame clear messages from an asset-based view. Program staff, community stakeholders, and medical and dental providers shared that it is imperative to meet a family's basic needs prior to providing education or very detailed services. Food insecurity was also the most common unmet basic need among families. For trust and relationship building practices, the study found that parents desire trust and respect from program staff and healthcare providers. Also, listening, showing respect, and recognizing the involvement of everyone at the table are desired and critical elements to building and strengthening relationships among community partners. Providers and community partners should also be very intentional about educating one another around the logistics of how they provide programming or services to families. Some of the implications from this study, from the lens of dental caries, obesity, and asthma community-based prevention strategies, include align communication methods and strategies among programs, providers, and service agencies. We should allow for texting with families. We should align the purpose, frequency, and content of the messages that we're sharing with these families, especially across dental caries, obesity, and asthma. We should consider texting platforms and applications for prevention education and resources. We should align messaging when promoting community education. To do that, we can coordinate upstream community-based education and prevention efforts, expand education to address overlapping risk factors between these 3 health conditions, frame prevention and education messages from an asset-based view, and expand community partnerships and networking among health-based coalitions that might focus on one of these 3 health conditions. So for example, for a coalition that's focusing on obesity prevention for children, We could invite a dentist to come and speak and share information with that coalition, or invite the dentist to join the coalition. We need to adjust program strategies to help meet a family's immediate needs before providing education. When applicable, I think programs should provide home visits and case management by a community health worker. We could partner with local food pantries to engage families and provide prevention education. We need to incorporate time and intentional program strategies to build and strengthen relationships. We need to be intentional and allow for time for building trust with families and community partners. We need to provide methods for two-way communication with families. We're often attempting to communicate with families, but families share that they really want to be able to communicate back with us in a reliable way. We need to be intentional and regularly recognize community partners and their efforts, recognizing everyone at the table that's working to improve the health and well-being of children and families. We need to provide ongoing education to organizations and medical and dental healthcare providers regarding the program services and resources available to families. To do that, we could prioritize cross-sector collaboration among prevention strategies and find a way to regularly educate partners, healthcare providers, and their staff members on the existing program services and resources available in the community to families regarding dental caries, obesity, and asthma. Thank you for listening to my presentation of this research study. I do plan on distributing and sharing my results and my research with others. I'll begin with sharing with my department, the Center for Children's Health at Cook Children's, and some of our community partners, particularly those that were involved as a research participant within this study. I'll begin looking for conference presentation opportunities within the next few months, and then also we'll begin working on a potential publication from my dissertation as well. Thank you. If you'd like more information, please feel free to email me or contact me, and I'll be happy to share more information with you. Thank you.